Constraint drives innovation. Everyone is constrained now. I can't think of a single industry, job, or person that's not impacted in some way by this pandemic. Now, there are people who are saying the Renaissance actually was given birth by the plague. And it just goes to show you humans are unbelievably creative. Now, Ray Kurzweil talks about the pace of innovation being exponential. And in this environment, it's hard to imagine, but the pace of innovation is actually increasing. Now, there are some industries that have been historically really slow to innovate. And we're going to talk about one of those today, which is the medical industry. Now, one of the most innovative companies on the planet, Apple, made news in the medical industry this month. They announced they're making 20 million face shields for frontline healthcare workers battling coronavirus. Now, Apple was legendary for its secrecy under Steve Jobs, but it seems like recently they've lost their ability to lock down their product launches. Supply chain leaks have made it relatively easy for analysts to be able to predict new products well before they're released. Now it looks like Tim Cook might have a new strategy to fool analysts and keep their new products secret. Elaborate cover stories. Now, back in 2006, at the height of the BlackBerry craze, and for a full year before the launch of the iPhone, a guy named Rick Mercer published a video about the next big thing for mobile communications users.
BlackBerry from RIM Systems. Text, web, email, power in the palm of your hand for the professional on the go. And introducing the BlackBerry Helmet, reinforced polymer to protect the skull of the mobile professional on the go, with an antenna for better BlackBerry reception so you can spend more time on your BlackBerry. And a camera that broadcasts a picture of what's in front of you to your BlackBerry so you can always be looking at your BlackBerry. The BlackBerry Helmet with optional safety flag. Protect your skull while you destroy your thumb.
Now, my sources deep in Apple's supply chain tell me really the next product from Apple is going to be called the iLid. And it's 3 helmets in one. It's a safety helmet, it's a COVID-19 face shield, and it's Beats by Dre headphones. And according to my sources, iLid 2 will have an augmented reality display, but Charlie Fink tells me that's not going to happen until 2023. Now, the medical industry has really been slow to evolve. And but that's changing now, like everything. And so we're starting to see virtual triage nurses in the way of chatbots on websites. Now, you've all seen chatbots, the little things that show up in the bottom and they say they're going to help you. And there's a picture of a handsome young man or a pretty young woman. Well, St. Joseph's Providence Healthcare operates more than 50 hospitals in 6 Western states. And what I did is I decided to try it out myself. And it asked me, where I lived, and it asked me if I was experiencing any symptoms. And I decided to try it out. And I told it that I was experiencing a runny nose. Now, it asked me if I was in proximity to anybody that was exposed to the coronavirus, or if I'd been told I was. Anyway, when I put in the runny nose thing, and it asked me if I was at risk, and I said no, it pops up this thing and it says, you might have coronavirus. And you might want to call 911, which is a bit terrifying for anybody using this. Now, maybe the chatbot wants everybody in California to call 911, or maybe it's just an elaborate marketing ploy to drive their $49 telemedicine calls, because hospitals are businesses too. Now, St. Joe's partnered with Microsoft to create this chatbot. And I don't know about you, but I would have rather preferred something like this, Nurse Clippy, you might have coronavirus. Would you like some help? Now, tech healthcare is going beyond chatbots. Doctors are now making virtual house calls. Now, I'm old enough to actually remember when I was a kid, I would have a doctor come to my house and check up on me. Now, XR Health is providing in-home mental health and rehab care in the UK. And Accurx is now an NHS-approved healthcare provider to provide telemedicine calls remotely with patients that don't have to leave their home. Now, I love this. Check out some of these healthcare redefining features from their website. Text messaging, which actually launched in the UK in 1992, and questionnaires, which I think SurveyMonkey launched in 2012, but surveys have probably been around since the late 1800s. So it's shocking how far behind the times our medical industry is. Now, this one blows my mind. Two-way patient conversations. But isn't the definition of a conversation two-way? It's supposed to be like you listen closely and you respond appropriately. So one of the biggest innovations in healthcare is doctors actually having conversations with their patients. But telemedicine platforms have been knocking on the door of the National Health Services, insurance companies, and large medical groups for years. And those institutions have always had excuses. Patient privacy concerns, cost, complexity. But all of a sudden, their income and livelihood is threatened, and it's like a stampede of wild horses into this new frontier of telemedicine. Now, speaking of stampedes, investors have been stampeding into Teladoc Health. Now, their stock has doubled so far this year. As people are just looking for pure plays on companies that are going to benefit from the change of behavior that every industry is going to see coming out of this coronavirus pandemic. Now, Teladoc recently reported serving up to 20,000 virtual visits a day, which is more than double since the first week in March. So telemedicine is exploding. Last week, Australia announced all their Medicare patients, which is basically everybody in the country, would be eligible for telehealth benefits immediately. So after years of doctors asking for it, they just flipped a switch overnight. Now I'm getting emails from doctors that I had to wait 3 months to see, saying they can now see me online tomorrow. The speed at which institutions are adopting radical change begs the question, why the hell did it take a global pandemic to do things that turned out to be so easy to do in the first place?